Major complaint is a broad nose, and he desires a thinner dorsum and a sharper tip. These are the two requirements that he has.
वो स्कैन देखेंगे उसके बाद फिर सर्जरी करेंगे. ओके, मोस्टली इनको 3 प्रोसीजर्स लगेंगे. नोज में 1 और जॉ में 2. After you see doctor tomorrow morning, let him explain you the surgery. That is important. What surgery, how much improvement. Let him have a look at the scan. After that, one by one. Yes. Okay.
Good afternoon.
You will remember me, sir.
For rhinoplasty?
Last 8 months back, I will came to you, sir.
पीछे अभी आके जो है
हाँ,
अभी अपॉइंटमेंट दिया अभी
rhinoplasty करना है. क्या करना है आपको?
No, sir.
हाँ, that's what.
नाम थोड़ा छोटा करने का है.
Last time आप ये भी बोला ये सर.
हाँ,
अभी वो करना है?
वो भी sir.
दोनों करना.
Hello everyone, here we are at Richardson's with another patient seeking 2 surgeries at one time, that is a rhinoplasty and a genioplasty. So this patient has, can you look to the side? So he has a depression at the radix, mild dorsal hump, also has a bulbous tip with a broad nose. So his major complaint is a broad nose, and he desires a thinner dorsum and a sharper tip. These are the 2 requirements that he has. So you have any breathing issues?
No.
No breathing issues. You just want your nose to be a little thinner
Yeah.
and this tip to be sharp.
Yes.
Any other requirement?
No.
No. So narrow dorsum and sharp tip is what he's looking at. Also, if you notice, his chin is very short. So we are going to augment the chin more vertically and horizontally. He does not have any jowling, which is good, but he is going, it's all, genioplasty is going to enhance his lower third of the face, so it will match with his facial proportion. This surgery should overall take us 2 hours, a little more than that, and when you're out, you will have some packing inside your nose, a nasal pack, for 5 days.
Okay.
And inside your mouth, the surgery is going to, you're going to have some stitches. All the surgery we are going to do is going to be inside your mouth. Only nose, you'll have a few stitches here and maybe here. That's it. Okay? So they're all hidden. The scars are going to be inconspicuous. So you don't have to be worried about any scars.
Deviated. He's got bony issues. And I'm going to show you the different views. We're going to do osteotomy. We're not planning rib harvest for him, but we're also going to make sure that his tip and the halar base relationship is improved. We're planning osteotomy, tip work, and also septal harvest.
All right, here we are with our post-op patient. It's almost post-op day 8, and he's heading home today after a rhinoplasty and a genioplasty surgery. So as you see, we have a lot of plasters intact, the rhinoplast, which I am going to remove. And it is quite painful because of the hair being present there. I'll move it fast. It'll pain, but it'll be painful less time. Oh, that's it. Better? Okay, so now we will do a pre-op and post-op comparison. So if you see his pre-op picture, he had a very short, a stubby nose, and he had something what is called like a V shape kind, inverted V shape kind of a nose. So he wanted reduction at the dorsal region. We can give him a mirror so that he can also see. So the mirror down. Yeah. So if you see, your dorsal width has been reduced. We've augmented the dorsum a little bit, given you a nice curve towards the tip. Tip, definitely you have swelling, it will come down. You had a very bulbous tip, and that has been corrected. Alar base, there's still some swelling on both the sides, and we've also reduced the alar base and made your nose a little longer than what it was and given it a nice shape. Earlier it was just one V shape, inverted V kind of a shape. Now if you look at the side, just look there. So now we have maintained this, there's no depression at the radix. This curvature which is there from the radix till the tip has been maintained, and overall given him a long nose. See up? Yeah. So the alar base symmetry also has been maintained, as you can appreciate in the basal view. Overall, the changes, what has been done, he has had no rib grafting. So whatever changes have been done is using the septal graft that we harvested, and his nose has become overall longer, narrower and sharper. This tip swelling should subside in the next 2 weeks. Now moving on to the chin. Again, we start with the, look at the mirror. Yeah. So he had a very short, a retruded chin. Now it is more forward. Augmentation is done both in the horizontal and the vertical dimension, although the vertical augmentation is less as compared to the horizontal. Also, it is in proportion with his facial profile. Look at the nose and the chin. So he has, earlier he had a very retruded appearance of the mandible. Now that has been corrected and he has been given a straight profile. So if you notice this angle, just look at the side and look at the mirror. Look completely at the side. Yeah. So this angle which is there, now that has been corrected. It's more straight now. You tell us, how are you feeling about the result? Are you happy?
Yeah.
Good. And how was your stay here? How was your stay, hospital stay?
Yeah, better.
Good? When are you going now today?
Evening 4 o'clock now.
Evening. After 2 hours. Okay. So since he's heading home in 2 hours, we better, we're going to proceed with the suture removal, clean, take some photographs and send him home. You will have a follow-up number. Okay, we'll give you a follow-up number. In case of any doubts, any problems, you message on that number.